Hello, friends. Uncle Marv here, and you're listening to the Unhealthy Podcast. Today, we're diving into some of the biggest health, wellness, and lifestyle stories of the past week. My hope is that these stories help you to make better choices a little more often than we do right now. So let's get started. New research suggests that what you eat matters far more than how much you move when it comes to obesity. Scientists analyzing 34 populations around the world found that people in more developed countries burn roughly the same number of calories per day as more active, thinner groups. But only one factor consistently tracks with rising obesity: diet. The data estimates that diet explains about 90% of the obesity trend linked to economic development, while physical inactivity only explains about 10%. That doesn't mean exercise is optional. It's still crucial for heart health, mood, and longevity. But when it comes to actually preventing and reversing weight gain, the message is clear: you can't outrun a bad diet. Even tiny shifts in sleep, exercise, and diet can buy you several extra years of healthier life. Data from a large long-term study shows that people who gradually sleep 5 extra minutes per night, add about 2 more minutes of moderate to vigorous exercise per day, and also clean up their diet, can see meaningful reductions in early death risk. This could mean several extra healthy years. The biggest gains come when people aim for 7 to 8 hours of sleep, an extra 40 to 100 minutes of weekly exercise, and a consistently healthy diet. The study found that none of these pieces worked alone, so combining them is what creates the real longevity benefits. Measles cases in the United States have exploded, and health officials are sounding a serious alarm. Already in February, the CDC has reported over 700 confirmed measles cases in the U.S. South Carolina leads the way, with a major outbreak driving more cases in 1 month than was seen in some years in the past in a full season. Nearly all of these cases are linked to communities with low vaccination rates. Up to 90% of patients were known to either be unvaccinated or have an unknown vaccine status. Public health agencies are urging everyone who hasn't had a measles, mumps, or rubella shot to get vaccinated, especially parents of young children and anyone traveling this spring. A landmark study reveals that your peak fitness may be over by your mid-30s. Following more than 400 people from ages 16 to 63, researchers show that aerobic capacity and muscular endurance peak somewhere between your late 20s and mid-30s, then starts to drift downward by roughly 0.5% per year, and then faster with age. By the early 60s, overall physical capacity can be 30 to 48% lower than at peak levels. The encouraging twist is that people who start or return to regular exercise in adulthood can still bump their fitness by 5 to 10% compared with staying sedentary. Strong relationships may be one of the single most underrated health interventions available. Research keeps piling up that people with close supportive relationships live longer and healthier lives, and this is equivalent to quitting smoking. The key is quality, not just quantity. Having a few trusted confidants that you see regularly matters more than hundreds of shallow social media connections. So building or rebuilding those bonds, we're talking family dinners, regular check-in calls, or even a neighborhood walk, can be treated as seriously as diet or exercise when you're planning your health. Experts are now treating fiber and gut health as core medicine, not just diet tips. New expert guidance highlights that boosting daily fiber intake is one of the most effective ways to cut your risks like heart disease, type 2 diabetes, and even some cancers. Many health pros are also emphasizing gut-supportive foods like yogurt, kefir, high-fiber whole grains, and colorful plants because they influence immunity, mood, and even body weight. The message is simple. Treat your microbiome like a long-term health partner, not a side thought. The latest data on ultra-processed foods will make you rethink that snack aisle. Studies reviewed in early 2026 that people who eat a lot of ultra-processed foods, things like packaged snacks, sugary drinks, and heavily processed frozen meals, have measurably higher risk of early death. One analysis found that shifting toward more whole foods can reduce mortality risk by around 15%, even without dramatic calorie changes. The takeaway isn't perfection. It's swapping out a few processed items each week for whole food options. More men are talking about mental health and using new tools to access them. In 2026, telehealth, therapy apps, and even virtual reality sessions are making it easier for men to seek help without feeling exposed. Clinics are reporting a rise in the number of men logging in for online counseling, driven partly by athletes and celebrity advocates who've gone public about depression and anxiety. The message here is that strength isn't about going it alone. It's about asking for support in a way that feels safe to you. Companies are moving beyond occasional therapy sessions to constant mental health support. Mental health benefits are being redesigned so employees can get coaching nudges, digital check-ins, and on-demand tools between sessions, not just one-off visits. Data shows that 28% of U.S. adults with mental illness still don't get the care they need, so employers are betting that continuous care will help close that gap. This trend means that your benefits package may start looking more like a 24/7 support system than a once-a-month therapy card. Funding cuts and shrinking services are putting already vulnerable young people at greater risk. Advocates report that programs like youth suicide hotlines and school-based mental health services are facing major funding cuts, even as the needs climb. Nearly half of Gen Z says they've never had a romantic relationship as a teen, and many boys and young men are feeling isolated and reluctant to ask for help. The worry is that without stable community-based support, a small crisis can spiral into serious mental health emergency. Exercise science is quietly declaring that short, simple workouts may be enough. Recent fitness trend analysis is showing that many people are ditching the hour-long gym sessions for short, data-driven workouts, which are 15 to 20 minutes of brisk walking, bodyweight circuits, or interval training. Experts say that consistency beats intensity. Showing up most days with a modest routine does more for your heart health and more for your mood than rare, grueling sessions. The message is that you don't need a complicated routine, just a realistic one you can actually stick to. Thanks for hanging out with me on the Unhealthy Podcast. Head over to the show notes for links to all the news and studies that I talked about today. If this episode resonated with you, tell a friend, leave a review, and hit that subscribe button so you don't miss the next episode. I'm Uncle Marv, and as per usual, remember to live healthy and be happy.